Diabetes, one of the world's most suffered diseases known to man. Most of the food we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help glucose get into the cells of our bodies. When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should. A rise in blood sugar, also known as hyperglycemia, is a typical impact of uncontrolled diabetes, thus leading to many issues with the body's frameworks, especially the blood cells and the nerves. In the year 1980, 180 million suffered from diabetes, and in 2014, the number has risen massively to 422 million. There are 3 types of diabetes. Type 1, Type 2, and gestational diabetes. Type 1 diabetes, also known as juvenile diabetes, is a chronic condition in which the pancreas produces little or no insulin. It appears during childhood or adolescent years. As for type 2 diabetes, it's a metabolic disorder that causes sugar to accumulate in the blood. This happens because the body can't utilize insulin that is discharged. Thus, the sugar builds up in the blood instead of being used as energy. Around 90% of people have type 2 diabetes, and it most likely occurs on adults. Gestational diabetes is a brief condition that happens in the middle of pregnancy. It influences around 2 to 4% of all pregnancies. Like type 1 and type 2 diabetes, gestational diabetes causes blood sugar levels to become too high. To prevent diabetes, you should engage more in physical activity, get plenty fiber, and consume more whole grains. These things will make you lose weight, lower your blood sugar, help your insulin control, and lower the risk of developing diseases in the future, like heart disease. Also, to prevent diabetes, go to the doctor. He will prescribe you with insulin shots to help maintain the insulin control in your body. Mainly, one should just eat healthier, maintain their body weight, and exercise for about 30 minutes on a daily basis. For each type of diabetes, there is a cause. For type 1 diabetes, it arises when your immune system strikes the beta cells in the pancreas that develops and produces insulin. When this happens, it is permanent. No one knows why this happens or what causes the attack on the cells, but it may be due to genetic or environmental components. As for type 2 diabetes, the cause of it is when the insulin in your body is not used efficiently. This most likely happens to people who are physically inactive, obese, and overweight. For gestational diabetes, which only occurs during pregnancy, is mainly caused by hormonal changes in the female body, which again may result from environmental factors or genetics. In its early stages, diabetes may or may not cause many symptoms that you need to get tested, but you can tell if you have diabetes if you experience one of these symptoms, which are extreme thirst, feeling tired all the time, blurry vision, feeling very hungry even after eating, urinating more often than usual, having sores or cuts that won't heal. If you are experiencing any of these symptoms, you should immediately go to the doctor and have a blood test to see if you have diabetes. And for every type of diabetes, there is a treatment strategy. For type 1 diabetes, the purpose is to keep your blood sugar level as close as possible to normal to prevent problems. Also, keep your daytime blood sugar levels before meals between 80 and 130 milligrams per deciliter. And after your meal, your sugar level after 2 hours of eating must not be higher than 180 milligrams per deciliter. And by achieving that, you must take insulin injections, frequent blood sugar monitoring, treatment for type 2 diabetes and gestational diabetes is also the same thing. Just eat healthy, exercise, maintain your body weight, and take insulin injections. To diagnose diabetes, you'll be given a glycated hemoglobin A1C test. This blood test indicates your average blood sugar level for the past 2 to 3 months. It measures the percentage of blood sugar attached to hemoglobin, the oxygen-carrying protein in red blood cells. The higher your blood sugar levels, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher on 2 separate tests indicate you have diabetes. A result between 5.7 and 6.4% is considered prediabetes, which indicates a high risk of developing diabetes. Normal levels are below 5.7%. Another diagnosis which will be taken is the random blood sugar test. It is a blood sample that will be taken at a random time, regardless of when you last ate. A random blood sugar level of 200 milligrams per deciliter or higher suggests diabetes, especially when coupled with any of the signs and symptoms of diabetes, such as frequent urination and extreme thirst. And for diabetes, there are tons of drugs a diabetic can use. One of the drugs that can be used are biguanides. Biguanides prevent the liver from producing glucose and helps to improve the body's sensitivity towards insulin. Another drug that can be used is called sulfonylureas. It works by increasing the amount of insulin the pancreas produces and increases the working effectiveness of insulin. A diabetic can also use pills called meglitinides, which reduces the likelihood of having side effects of hypoglycemia and weight gain. In conclusion, diabetes is still a major problem that is increasing in our world and needs to be reduced for the sake of the people's health and proper living. According to the Gulf News newspaper, a 2017 survey revealed that total percent of diabetes among Emirati citizens is 19% out of the whole population. Emiratis usually get type 2 diabetes in later age due to the rapid economic growth in the UAE, sedentary lifestyle and unhealthy diets, and also 1 out of 5 people in the UAE suffer from diabetes. There are many ways to prevent these kinds of incidents to happen or occur and prevent the complications of getting these types of diabetes. Many doctors develop many steps that can prevent or delay the occurrence of diabetes. For example, eating healthy foods, exercising, monitoring blood sugar levels, and taking insulin injections. These are the steps that will help you avoid being a victim of diabetes. Furthermore, you can have your blood tested to see if you are getting any symptoms of diabetes that you can prevent by using medication and following the list of instructions that is provided for you. Lastly, everyone must be aware of the dangers that can result from diabetes and take precautions for their own good and safety.